So this young lady said, I had my fibroids removed in 2005, and it was the size of a small ball. 5 years later, they returned 20 to 30 small walnut-sized ones.
Yeah.
But now the doctor will not do surgery anymore. Can you help me?
Of course, she doesn't need a myomectomy or hysterectomy. That's one of the challenges with myomectomy. She'd be a great candidate for UFE. Easily help her. Samir, you can add to that.
Yeah, absolutely. I think that this is kind of touches on what I was saying earlier, that if you've had a myomectomy done before and the fibroids have come back, I think fibroembolization is the best option here, especially when you get to that number of fibroids, 20, 30 fibroids. No one's going to go in and try to do another myomectomy and try to take out 20 fibroids, because it's just not technically possible. 20, 30 fibroids, would be very, very challenging for a myomectomy. Your best, most minimally invasive option is uterine fibroembolization. And of course, you always have hysterectomy, but again, there's everything that we talked about with hysterectomy.
I understand.
It's unsafe to try and do that many. You'll find some aggressive person out there will say, "Oh, I'll do it," but it's dangerous. A lot of blood loss, a lot of challenges. You can have other complications.
Okay. So quite a few questions, gentlemen, about insurance and how does that work? Is it covered by your regular insurance?
Yes. So all insurances cover this. And, honestly, if somebody does not have insurance, we find a solution for them. We'll find ways where we can put together some payment plans for them, or if they have Medicaid, we'll take care of everybody one way or the other. And that's another reason why we've started to work with not-for-profits to find folks who can get relief somehow. We're not going to turn somebody away.
That's amazing. Thank you, gentlemen, for that. Okay, so this, and I think you answered this, but she put it in as a question. She may have jumped on afterwards. She said, I'm afraid to go to the hospital because of COVID, as most of us are. So what hospital would I have to go to, and how would you handle this?
Oh, we do this all outpatient. You will not be in a hospital. This is an outpatient. It's our office center. We follow every precaution. We've actually got our own testing now. So we make sure everybody's tested, we take every precaution, and we make sure that you're 100% safe. So you will not even get into the perimeter of a hospital.
Very good. Now
so
we have, go ahead, I'm sorry.
I'm going to ask Dr. Ahmed if he wanted to add anything to that.
Yeah, I was just going to say that, this is all done again at our outpatient vascular centers. These centers are specifically designed for treating fibroids and other vascular issues. And they're completely COVID safe. I actually serve as the medical director of the practice too. So, I've worked very closely with Dr. Chopra to ensure that we have all the proper guidelines, et cetera, in place to keep our employees as well as obviously our patients very safe. Because at the end of the day, going to the hospital is, it involves a lot. There's a lot of risk that you take on, but we wanted to create a center that kind of takes away those risks, especially when it comes to COVID. So, we always say that our centers are COVID safe, and we mean that. We work very hard and very long to ensure that.
Perfect. Okay, so we have two last questions, and this young lady lives in Madison, Wisconsin, and she's trying to find out what would she have to do. Do you have a location near her, or would she have to come into Chicago?
So we actually we already do this as a televisit. We are close to O'Hare Airport, so I've been to Madison many times myself, so it's a short ride. I've had patients come from all around the world, and sometimes we'll have them stay locally and in a hotel or somewhere where they're safe. We, like I said, all you have is a tiny little wristband at the end of the procedure. So we'll have to do the procedure here in the Chicagoland area, but all the evaluation can be done via telehealth. Okay. I've had patients come from Florida, California, Eastern Europe, several from Wisconsin, Michigan, We've had them come from all over.
Yeah, I
Very
think that's an excellent point that, the only visit that you'd have to make would be for the procedure itself. Everything else, the pre-op, the post-op, follow-up, their imaging review, et cetera, all of that can be done remotely. So technically, the only time you'd actually have to come in would be just for the procedure, and the rest of the care can be done remotely.
perfect. And well, next to our final question, they're asking, where are you located and what's our next steps? What do I do next to see if this procedure is good for me?
Yeah, so the first step is go to mimithealth.com and you'll check out our locations. You can click on schedule an appointment. You can call us. You can email us. Any way you like, you connect with us. If you can't come in, we can do a televisit, collect all your information and evaluate you. But ideally, if you come in for a consult, that's the best. We'll look at all your information together and go from there. We obviously want to make sure you're a good candidate for this, what the problem really is, exclude anything dangerous, and make sure you're safe. But that's the next step. Your immediate next step, get on the website, call us, click, and connect with us so we can get this rolling.
Okay. So ladies, you've heard, yes, it's covered by insurance. Yes, we can do it. If you are all over the world, you can just come in. And finally, yes, they are here to service you, and they want to make sure, as Dr. Chopra said, they will make sure that they get it done. So whether you're having an issue with insurance, or he said that they will find a way to make sure that they take care of you. Final question, the ladies would like to know, is there any way to prevent fibroids?
First is you got to stay healthy. Bad diet won't help you. The adage I live by is that wellness and happiness are not the absence of problems. They're the presence of solutions. And the other thing is, if you quote the Bible, Corinthians 3:16, your body is not your body, it's God's temple. So you don't desecrate it. So good diet, living healthy, not doing the things that are going to hurt you, right? So you take care of that. Is there some magic pill to prevent this? No. But don't ignore the signs and symptoms. If you're bleeding 7 days out of the month, something's wrong. If you're bleeding very heavily, ignoring it is one of the first things. Like we said, just life happens, right? So fibroids happen. But when you first find out you got a problem, focus on being healthy, take care of it, and go for it. Because we all God's creation, whatever you want to name it. Even COVID-19 is actually God's creation, but fibroids too. But we have to find a solution to the problem for us to live our best lives. So from that point of view, living healthy, whether you eat a good diet, regular exercise, all in moderation, all in balance is a good way. But when you have a symptom, when you see that something's wrong, don't ignore it. Samir, feel free to add anything to that. If you
want. I couldn't have said it any better than that, Dr.
All right, doctors, I really appreciate you, and I'm sure the ladies appreciate you. We've got so much information. We saw some wonderful examples, some great slides. So ladies, you no longer have to suffer in silence. You can call today to schedule your consultation. Here's the number, 708-486-2600. Again, that's 708-486-2600, or you can log on to MIMITHealth.com. That's MIMIT health.com, so that you can make your first step to living fibroid free. Thank you so much, gentlemen. I really do appreciate your time. And ladies, I know they can't see you, but let's give them a big round of applause.
Oh, thank you. It's here.
And before we leave, ladies, I do need to ask that you would take a moment and just click on our survey and complete those 4 short questions for you. And again, we want to thank you for your time this morning, and thank you, Senator Hunter and Dr. Ahmed and Dr. Chopra and everyone who was involved on today. We just really want to get this information out please share the information. Tell someone about the information, because we are, as African American women, we are #1 in fibroids. And it doesn't have to happen. And that too, we're #1 with hysterectomy. So it doesn't have to happen. We've seen women as young as 25 who have come to us and talked about that they were given a hysterectomy. And we don't want that to happen to anybody else. There's another safe, non-surgical option for you. And today you just heard about it. And I am just asking you to share and tell a friend about this information. So again, you can call 708-486-2600. That's 708-486-2600, or log on to the MIMITHealth.com. That's MIMIT Health.com, so that you can live fibroid free. Thanks again, ladies. That completes our program for today. Don't forget to finish that survey for me, and we appreciate you. Everybody be blessed. Have a wonderful afternoon.
Thank you so much.
Thank
God
you.
bless you.